All right. I'll continue to let people in as we talk, but I'd like to get started since we will only be here for an hour. And I'm going to ask you to introduce yourself. I'll just call on you as best I can here. And I will tell you to begin with, just to model. Again, I'm Kathy Wilson. I'm also a member of the Larimer League up here. I have minimal experience with healthcare, other than a very long time ago, I was a Lamaze instructor in Southern California for several years, which was a whole lot of fun. But that's about the extent that I have. So why don't you give us, please introduce yourself and tell us if you're in a local league, to let us know which local league you're in and what brought you to this meeting. Okay. Beth Kinney.
Well, do you hear me okay?
I can, yes.
Good. Well, I am a member of the San Luis Valley League of Women Voters, and I was asked to be on this committee, which I was happy to do. I had been intermittently involved in the Physicians for National Healthcare Program. I'm a retired physician, and I always wanted there to be Medicare for all my entire career. I went into primary care hoping and expecting that pretty soon there'd be Medicare for all. And instead I found myself fighting insurance companies and being horrified at the dilemmas that patients were in trying to get care that they needed, and the dilemmas that I was in trying to give them the care I felt that they needed. So I'm anxious to get involved.
Great. Outstanding. Okay. Donna.
I'm Donna Nielsen. I'm a facilitator for the Gunnison Group, co-facilitator, and I'm a retired nurse. I worked in our small community hospital in Gunnison, so I certainly saw a different view from a number of my colleagues. And I did quite a bit of administration and nurse education. And as you pointed out, Beth, working with patients means that you find out that many of them have struggles, and certainly healthcare is a right, and we're not providing it.
All right, welcome. Cheryl.
Hi, I'm Cheryl Clement. I'm from the La Plata County League of Women Voters, and I am a nurse, master's level nurse. I did everything in my career from hospital nursing, supervisory positions to public health, and I ended my career 11 years at the end with a biotech firm in California. I did a lot of training, compliance, you know, that type of thing. And I was a quality manager in my department. And I just recently joined the league here in La Plata County about 6 months ago. And they were happy to have me on the healthcare committee. We just finished a survey, community survey, asking for opinions about healthcare, what people thought of their insurance, their physicians, the local hospital. And I'm really interested in learning more about the whole healthcare system in Colorado. It's a little different from my experience in California. So that's why I'm here.
All right, thanks. Oh, that's great. Betty.
Betty Seelan with the Jeffco League, and I've been interested in healthcare for a long time. Over 50 years ago, I actually did work for the Utah State Department of Health and vital statistics. But I've been more involved with different healthcare studies through the league. And I'm particularly interested in the direct, what is it? DCEs, direct contracting entities. I think they're a real danger to Medicare, and I'm really interested in learning more about that and getting public officials on board with that, because I'm not sure they're aware of it at this point.
Mhm, mhm. Very good, thank you. Let's see, Karen Sheik. There you are, okay.
And my mic is even live. I'm also on the board. I was past president and now I'm serving in the role of local league support. I also belong to the Montezuma County League, which is in Southwest Colorado. I've been interested in healthcare for a long time. Like somebody said earlier, I think we should have Medicare for all, and I'm really unhappy that we can't get legislators to buy into that for whatever reason. I think I know why, but I also heard a really interesting segment on the news this morning about companies buying hospitals and basically on a profit motive basis, and then either selling them or indebting them to the point where they have to close. And a lot of these hospitals are in service areas where it's hard for people to be able to get health care. So I'd love to see us be able to see what we can do to help promote some legislation that might prevent that.
Mhm. Great, thank you. Sandy.
Hi, I'm Sandy Schuster. I'm in the Jeffco League. I'm the second vice president. I was in healthcare like the other nurses here I did it for over 50 years, various places around the country because my husband was in the Air Force in our early years. And I've done a lot of teaching and administrative work and quality assurance and risk management. And I've worked in a few of the hospitals here in Colorado. I live in Jefferson County now. And I was part of the push back in when Hillary Clinton came out with her healthcare policy. And I feel like we haven't really accomplished a lot. I know Obamacare helped some things, but they watered it down so much that there's just too many gaps, too much. We need Medicare for all.
Mhm, mhm. Excellent, okay. Beth, did we have Beth? Did you? Yes, I called on you already, so that's fine. Kathy Winchester?
Hi, I'm Kathy Winchester. I am a new member to the La Plata League. I am interested in healthcare because all my life I've worked in healthcare. I was registered nurse, moved on up to a manager of an ICU, CCU open heart unit. And at the age of 35, went to medical school and became a cardiologist. So the most important thing for me is to take care of patients, but also to have sound advice given. And I think that nurses and doctors are very important on this task force because it is such an important decision for the country and for our community.
Excellent, thank you.
Mhm.
Welcome. Robin.
Hi, my name is Robin Bowman, and I am a colleague of Cheryl's, also very new to the La Plata County, League of Women Voters. Background, an ICU nurse for many years. I was a travel nurse, and then left the bedside and worked in the pharmaceutical industry, inpatient rehab. And then recently I have been a professor in the School of Health Professions at the University of Missouri, teaching healthcare. And as a result, of course, is a big passion of mine, along with ethics. And so, as many of you have already said, there's many problems, and you can pick one can pick about any part of it that needs some rescuing. I'm a big component of advocacy, and given how complicated the system is, until we can see some big change as being an advocate for the patient and helping them understand how to maneuver this very complicated and fragmented system.
Mhm. Right. Hope. Hope was in a meeting with me yesterday, so.
Yes, hi. Hope Shuppleman. Little background on me. I have been in healthcare for over 25 years. First started when I was in the Navy, the United States Navy, as a hospital corpsman, then ended up at the bedside as a bedside nurse for many years. Most recently, ended up being a critical care nurse practitioner. Did work in COVID with the COVID units. For me, being on this task force is very important. I feel that we definitely do have a fragmented system. I am very interested in all the legislative bills that are being brought up to our Congress and House. We need to really look at it from a vital standpoint, because this is vital to our communities. This is most important to me because, as somebody who lives in the La Plata area, I have seen how our health system has started to fall apart, and I really want to see what I can do for my community, first and foremost in Colorado and the nation itself. So thanks.
All right. Thank you. Marilyn.
I'm a retired chemist, master's level, and I took training at Regis University in health information management when I quit being a chemist in 1995. And I am advocating for single payer, but I'm not doing it with League of Women Voters. I'm doing it with the National Committee for the Preservation of Social Security and Medicare. I went to the convention, and I was very active in the concurrence part of the system, and I go to meetings every month with the Barbara Pearson's group that meets on a monthly basis from all the other people. I'm retired and at the beginning of January of 2022, my husband and I were privatized. We were put into a DCE or a ECO reach, and without our permission, without any education. The way you found out was, well, I was just starting to suspect it because I had, because with the National Committee, I've learned a lot of things about what's going on with the privatization. And I called the practice, our doctor we've been going to for over 20 years, and she didn't even talk to us about that. I mean, and the manager, practice manager would not talk to us about that. Oh, everything's just fine. It's not just fine. Okay. It is being privatized, and we are just becoming commodities. They're making money off of our system, and they're taking down the Medicare fund that we have. So I sort of sound kind of cranky. I am about that, very cranky. Okay.
That's very understandable. Skip, we haven't heard from you yet.
Hi there, I'm Skip Randall. Retired physician assistant, went through the Baylor College of Medicine PA program, worked at MD Anderson Cancer Center for 3 years, and then the rest of my practice was in California at Kaiser Permanente in primary care. I felt for many, many years that our healthcare delivery system is dysfunctional, unfair, and I'm a strong advocate for universal healthcare in America. and also reform of the pharmaceutical aspect of healthcare. And I want to work toward those goals. Oh, I'm a member of the San Luis Valley League.
Okay, thank you. Okay. And welcome, Andrea. Glad you made it here. We're just going through introductions right now.
Thanks, Kathy. I'll jump in and introduce myself. I'm Andrea Wilkins. I'm the legislative liaison with the State League. I'm here to support and help connect the work that's taking place with the task forces to the advocacy efforts undertaken by our Legislative Action Committee. I'm sitting outside of the Denver Santa Claus shop where my Girl Scout troop is volunteering. So I'm in my car. It looks very weird that I'm just like sitting in the dark, but they're in there working while I'm doing the call. So sorry about the weirdness, but I wanted to at least turn my camera on. So anyway, nice to be here.
I appreciate that. All right. I don't know how many of you are aware of this, and I didn't realize that I would be screen sharing, but I hope I can. So wait one moment, please. Let's see if I have it up here. I'm going to try one more time. We have, I don't know how many of you are aware that the Colorado League has a website for each one of the task forces. And I guess I can't talk and chew gum at the same time here today. I apologize for this. Let me try this one more time. There we go. There we go. All right, this is the State League website, and on this website, under advocacy, you're going to see all of the state task forces, and there is a page for healthcare. You'll see some of the background of legislation that the healthcare team has and the Legislative Action Committee has been following over the years in this area. But I wanted to show you down below. There's an area for resources here. And how do I let somebody in? I'm sorry, there's a lane. Okay. This is an area that if you find articles that would be helpful to the team in general, we have a few books here, but you can send either to Beth Hendricks or you can send those links to me, and we'll be happy to add them here to the website. Again, what you want to do for the task forces is to go to the League website, and you can see that right now I'm not logged in, and that's because we can have members in the task forces who are not members of the League, so members of the general public. So if you know people who would be interested in the topics that we'll be covering in this task force and the work that we'll be doing, you can invite them to join us too and find out more about it. There's a place on this website, on this web page, where they can join the group. And are there any questions about the task force website? So if you think of areas too that you think are beneficial for all of us to know about, please let us know and we can put it up there. All right. Yes.
Kathy,
Karen.
I did some research and came up with a whole list of books and documentaries on healthcare, and I thought it had been uploaded to the forums page. I couldn't find it with a cursory look just now, but I will pull that up and I will send that to you.
Okay.
Some of the things that are listed on the website there are books that I found, but I found a lot of other stuff too. So
that would be terrific. One of the problems with putting it on the forum is that members and task forces who are not members of the league can't access it. And so that's why putting it up on the task force webpage is more helpful to those people. Elaine, I see that you have joined us. We just before I was showing the webpage, we just introduced ourselves. So you want to just tell everybody who you are and what local league you're associated with and some of your background.
I'm Elaine Branyard, and I am a member of the Larimer County League of Women Voters and also the health team up there that's very active and it has been for a long time. So it is really rather exciting. I'm a retired nurse and have been working in healthcare reform for quite a time and working on universal single payer healthcare.
All right. Well, that's excellent. Excellent. So Beth Hendricks and I were trying to brainstorm an agenda for tonight, and since neither of us are really in this area, we can open it up. But one of the things that Andrea, I think you got, if you're still there, you got an email from Carol Pace about a group that former state senator Jean Nicholson is forming. It's a coalition on publicly funded healthcare, which, as you were all giving your introductions, several of you were talking about Medicare for all or universal healthcare, different ways of expressing something similar in that way. And so it's you are there. Good. Andrea,
Yep,
do you
I'm
know
here.
any more about it? Because I saw your email today. We added it to this agenda because of that.
Yeah, so it's my understanding that there has been one meeting of the stakeholder group, but I think the conversation really is kind of at the very beginning. So it would be a great time for a representative from the league to jump in. The discussion is around publicly funded care. It's also my understanding that this is in preparation perhaps for an intended ballot issue. And then I think there's also going to be discussion about legislation that is coming up for the session. I don't know exactly the focus, but when Carol had sent along the information, she had indicated that we should get in touch. Anyone that's interested in participating should get in touch with the conveners to just get a little bit more information on the next meeting date and sort of what to expect. So I think it would be a great time for us to jump in. It's always nice when we have the opportunity to participate in stakeholder discussions at the formation stage, because that's when we can have the most influence. So if any of you are inclined to participate with this group, we were really pleased that they reached out to us specifically looking for a representative from LWVCO. So if anyone's interested, we would love to get you connected. And Kathy and I or Beth are happy to facilitate connections or do whatever we need to do to make sure that you have the information you need to participate.
Mm-hmm. Sandy.
Is it did you say it was a state group looking at a state law?
It's a stakeholders group, so different community organizations that are interested specifically in discussion around a public option, publicly funded care.
But for the
So
state or for federal?
State.
for the state.
For the state.
The focus would be on the development of a possible state ballot issue.
And I'm trying to remember if
It's
with
kind of a states.
Sandy,
Doing different, nobody's getting allowed to do anything.
you're
Every
breaking.
state
up.
does their own thing. It probably isn't the best way to go about it, is it? Any thoughts?
Sandy, I'm only getting bits and pieces of what you're saying. I'm not sure if it's my connection or if others are having a hard time hearing. I didn't really get what you were saying on that.
My thought is that there's, by breaking it up into onto the state level, and I know that's what people who don't want to do, because then they can keep their hand in it without it getting too complicated for them. But I think if we don't have a federal law or a federal policy, it's just going to be 50 different things going on and nothing's going to actually be good. We need to somehow get Medicare for all. So that would be at a federal level.
Skip, you had your hand raised.
Yeah, comment on that. I've been waiting for something to happen on a federal level for 40 years. And unless there's a sea change in the politics nationally, I don't see that happening. So I think we ought to work toward it here in Colorado.
Beth.
I would also point out, I agree with Skip, and I would also point out that in Canada, it really started with one province and then spread when it became successful. I was so excited a few years ago when it looked like it would happen in Vermont, but Vermont just didn't have the population to pull it off. I mean, and my understanding is that Colorado has enough people living here that it would be a viable option. And if it was successful, I think it would spread like wildfire myself.
Sometimes you have to get the ball rolling. Marilyn, did I see your hand raised?
Yes, well, yes, because I went to a meeting where T.R. Reid was speaking to a group, and it was, I think they were called the Universal Healthcare or something like that. It was probably, the meeting was probably in May or maybe October, sometime along in there. And what has happened, at least my information that I learned, is that the legislature has, has said we want to, if we're going to have universal health care, we're going to give it to the people to decide. So that's why we're going to be voting on it if this goes through. And in the process, I understand that they had a committee of all the smart people, the best people they could get to study, well, what would this be like for Colorado and that sort of thing. And one of the things that kind of made it down for me was when they were doing the lobbying kinds of activities, the legislatures hadn't even read the report. So, and then, and they paid money to have this report done. So I don't know if, Andrea, do you know anything more, about it? Because it's kind of like laying down instead of getting up and letting people know that that's what's going on.
Yeah, and I don't have a lot of details about, the conversations that have taken place so far within this group, or, if any discussion has been had about, where they're ultimately heading. But I do think that, it's important that we participate in the conversations, because I think all of these points are really valuable to raise. And, really the only way we can have a lot of influences to kind of get in, you know, in those beginning conversations. So I think this poses a good opportunity for us to have some input really across the board on the issue that's being contemplated, but you know, broader perspective too.
Kathy, it's
Yeah.
Kathy Winchester. If I could, I don't have my video on because I have a cold. But if I could make a comment.
Sure, please do, please.
Working in Southwest Colorado for the last 18, 20 years, and then working in California, we never turned anyone away, but we did see the biggest problem was the working poor. I think that you've hit the nail on the head when you say it's going to take time to get this done on a federal level. When I look at the Canadian model, the problem with the Canadian model is that it is such a huge wait time to get in to see specialists that we had people flying in from all parts of Canada to our practices in California. And because they couldn't get their open heart surgery, they couldn't get their CT scan, they couldn't get their chemotherapy. So it's a model that now Canada is putting over $1 billion to try and figure out how to solve the wait time. This cannot be repeated in our country. I mean, when you look at the amount of money we spend on healthcare, it's double and triple what Canada and the UK is. My problem locally is the working poor they come to the hospital and they get taken care of, but they end up with thousands and thousands of dollars in bills. So the question is, can we start at the bottom and start working up? Because we know it's going to take time to make this even for the state, to make it a single payer system. I mean, we have to figure out, how do we change the poverty level so people get better coverage? How do we take care of the current patients? Why do they get two different types of bills? If you're a cash payer, you only pay a fourth of the bill. But if you're an insurance payer, you pay, you know, your insurance company gets a 50% write-off. And I agree, we also have not insurance companies, but healthcare companies that are buying up practices, and physicians are leaving. I mean, physicians are leaving Southwest Colorado. We have a huge problem down here just to maintain primary care. We have doctors flying in from Denver, and so it's the doctor of the day. Nobody gets to see a regular physician. So I think that identifying the patient population at the biggest risk, which is the working poor, and at least helping those people to start with, we have to do something. Or it's like you say, they'll be living on the street eating, you know, McDonald's for 99-cent hamburgers.
You know, what I'm hearing you say, Kathy, is really reflecting one of the ideals of the league, and that is to represent people who don't or can't represent themselves well. And you really brought that up when you were talking about how
Well, I do want to make one comment on that. And this should be known by the legislature. We physicians tried to do as much pro bono work as we could, putting pacemakers in homeless people who had no insurance. We gave drug samples to patients. And then what happened is we were cut off by Medicare and by the state from dispensing medicines samples from the drug companies. I mean, some of these drugs are thousands of dollars a month, but we were chastised for doing pro bono work. We were threatened with our jobs for doing pro bono work. I mean, it just makes no sense to me. So they took away sample closet. We were no longer able to give a patient a month's worth of samples so that they could save up enough money to buy the drugs. I mean, it's crazy. It's not just the drug companies, it's the healthcare providers who limited physicians in doing their job. I mean, I would walk out to the parking lot and give patients medication so that the hospital or the practice wouldn't be responsible for it. Isn't that sad?
Yes, yeah. It seems to me though that that's a reason to join in the discussion of this coalition, since
Yeah,
it's
well, that's why I'm
right at the base level and trying to work on these issues within a bill that they're trying to create.
Right.
Hope.
Yes, thank you. I do have to piggyback from what Kathy Winchester was actually mentioning.
Mhm.
Is I do believe that we need to look at the working poor. As somebody who has worked at Albuquerque at UNMH, I saw a lot of working poor there when I was working in the COVID units. So my question is, how do we help without having to infringe on everybody else's healthcare rights, right? So the working poor is really where we really need to focus, and that's truly the grassroots level. I'm a firm believer in single pay option because I do know that we have Medicaid here. We do have Medicare for 65 and above. We do have people that are employed that can have health insurance with their jobs. Like with my job at UNMH, it was a great healthcare plan, but not everybody has that ability. And the working poor are, they don't meet that criteria of the 150% lower than poverty. They're a little bit above that. I know there are people that are still waiting for maybe some images, but it's not, the 4 and 5, 6 month wait that I just spoke to one of my critical care nurses before leaving UNMH, her partner lives in Canada, and they are having to come over from Canada because they are waiting 7 months to get imaging. She has cancer. So I am really concerned about going towards a universal healthcare system where we've already had the experience. We watch it on a daily level and all the time with Canada. I mean, there's an article in the paper just 2 days ago that, now they have allowed MAID, Medicare assisted suicide now for people that cannot get drugs or that are veterans for PTSD in Canada. So they're giving them an option to have assisted suicide because there's such a long wait. And so I'm concerned with the state of affairs in Canada. If we start mimicking that model, where are we going to put ourselves?
And that would be a reason to be part of this conversation then. Karen.
Well, I was just going to say, we're rapidly reaching that critical point here in this country. It's very hard to get in for an appointment. I've waited months to get in for diagnostic treatment. And, I kind of laugh when I talk to them when I try to make an appointment on the phone, and they say, well, we don't have any appointments until, February or March of next year. Well, I may not be around by then if we can't get in sooner than that. So it's concerning to me that the argument that we're using against some of these single payer systems is that, oh, there'll be long waits. We've got long waits in this country now. So I think your point is well taken. How can we avoid the pitfalls of those single payer systems and yet at the same time revamp a system that's obviously it's in critical, it's in the ICU right now.
Right.
In this country.
Any final comments on this? This is obviously a hot issue. Beth, did you have your hand raised?
Just a quick note that, you know, Canada has hard waiting times, and that's something we want to avoid.
Yeah.
But we have to remember too, that we would have even longer waiting times if people actually had access. But so many of the working poor don't even get on a waiting list, and they're not counted as part of that waiting, you know, of the waiting time that would be if they really were able to access care. So I agree that working for getting the working poor access is, you know, I think that's why single payer may be the way to go.
Okay. Anybody else have a final comment? Yes, Skip.
Yeah, I have to do a plug for my profession, physician assistants. I think nurse practitioners and advanced practice nurses and PAs, one of the reasons I went into that profession was to expand the access for healthcare to non-MD providers that are a little more cost effective. And I think that has to be a emphasis both here in Colorado and nationwide. More increased use of mid-level providers.
Okay. Right. Yes, Sandy.
Also, not to take anything away from the work for the poor people, but middle-class people are having a hard time as well, because it goes with your job. It goes, kids can't get health care because they may not be able to get a full-time job. There's a lot of things that, and I know that Obama had some, but there's just so many things that, and the prices are going up a lot for the plans, and the plans run the hospital and they run people.
Sandy, you're breaking up.
Who can have care?
Yeah.
Oh, sorry.
All right. Well, I just put my email address in the chat. If you are interested in getting involved with this discussion, with the league in mind, please let me know. You can let Andrea know, or Beth Hendricks, and we'll get you connected with what's happening with that coalition. And I truly encourage you to do that. There are so many aspects of this problem that I learned just from listening to you. All right. And so I think sharing these different perspectives is a very important thing to do, so that we can move forward and we can get something done.
Betty has her hand up.
Yeah, I just saw Betty.
Oh, okay. I think we've pretty much defined what the problems are, and there are lots of them. But what can we, as a state committee, do about it? And do we know who do we contact to find out proposed health legislation at the state level now? Is that any of that known? Because that would be one area we could actually, work on. And my other question was, is this committee with Jean Nicholson, is that related to the program that Bill Simple talked to us about last spring or sometime or another?
That I don't know. Yeah, I don't know if Andrea does. I'm trying to see if there was an interim committee that submitted a report with legislation during the summer, from the summer.
Yeah.
I don't believe they did, Kathy.
No, I'm looking
I
through.
was I was sifting through all of the interim bills today, and we don't have committee recommended bills on healthcare. But I do believe part of the discussion of this group, in addition to a possible ballot initiative, is also going to discuss anticipated legislation. So I think that would be another way to kind of tap into or get some early insights into what is being considered and what some of the early bills might be on the topic.
So are you talking about, just to clarify for me, are you talking about Jean Nicholson's group to tap in for that, or other legislators in the state who have been talking about this type of thing to see if anything is bubbling up now for the upcoming session?
No, I was talking specifically about Jean's group, that
Okay.
I think that the discussion is going to be a little broader than just the ballot initiative. I could be wrong about that. I don't know exactly where the conversation went after that first meeting, but when it was first presented, I thought that it was going to be a little broader than just the ballot initiative.
Okay, great. Right. All right. Again, I really encourage you. This seems to be a passionate issue for many of you. Okay. I encourage you to get involved with it, to share your insights.
I know, Kathy, I'm sorry to interrupt. I don't know, since I chimed in late, if I had missed any discussion that you may have had about more healthcare coverage for LAC, because we do tend to see, not surprisingly, given the scope of the issue, we do tend to see lots and lots of healthcare legislation introduced every session. And we've recently had some transitions in our citizen lobbyists that have been covering the issue. So, it's an area that we absolutely want to continue to follow closely and weigh in on. But we really could use more coverage on the topic through the Legislative Action Committee. And I apologize if that's redundant, but I just wanted to make sure to kind of get that plug in.
No, it's not redundant at all. I was gonna hit that in a little bit as well. And just I'm going to add one thing to what Andrea was saying is we are the Legislative Action Team is putting on part 2 of an action and advocacy training for people who are in the task forces and people who are in or thinking about joining the Legislative Action Committee for the state, especially. And that's going to be this Friday morning. Part 2 will be this Friday morning from 9 until 10 a.m. So it's we're doing this in smaller chunks. It's part 2 of 3 parts of training, and you can register for it. It's on Zoom. You can register for it on the League of Women Voters Colorado website calendar. And I encourage you to do that, please. I want to underline what Andrea just said about really considering joining the Legislative Action Committee, because if you are interested in following the healthcare legislation, we could really use the help in that area. And that's behavioral health as well as the types of health we've been talking about today. So let me encourage that. We only have a few minutes more. And I was going to propose a few other things that had come up in the news, but I'd really like to know what area, in addition to this area that we've been talking about with the single payer, what other topics you would be interested in exploring with this group at the state level.
Kathy, I have a quick question. Robin Bowman, being very new and with a healthcare background, but being new to Colorado, Cheryl and I came across an article, The Toxic Impacts of High Healthcare Costs on Coloradans. And this was something that came out of the governor/lieutenant governor's office in 21. And there seemed to be a lot of legislative items that came off of this. It was a survey and very relevant to many of the items that we have talked about. And I was wondering if you were familiar with what came from that. I mean, a lot of these items seem to be possibly taking place through legislation in 23. A lot of them are pretty general, but I was just wondering if the league had any involvement with that survey.
The survey, Andrea, do you wanna field that one?
You know, I'm not, I don't know that I'm familiar with it. So my guess is no, but I wouldn't swear to that. Yeah, I just don't recall, or I'm not aware of any involvement by the league.
Yeah, okay. We have 3 hands up. Hope, we're gonna start with you and then go to Betty and then Kathy.
Yes, I was just wondering, when we log on to the legislative training, because I will be on that Friday, since I missed the first one, will there be an option to join the first session again? Do you guys have a?
The first session is on the State League's YouTube channel. So you can watch that first hour there. I don't know if you've, I just learned this, a couple weeks ago. If you go to the state website and look up in the upper left-hand corner, you'll see a row of very small icons. There's one that's red and white. That's, I think, the next to the last icon. That's the icon you can click on for the YouTube channel and get there easily.
Okay.
Yeah. So yes, it is. We did video. It is there.
Fantastic. Thanks.
Yeah.
Our health committee met, and Annette Cannon, who is our county coroner, is very interested in healthcare and is on our committee. And she is also interested in, it's a substance abuse, county task force that's making plans for how to use the drug settlement money. And so I think locally we should probably be following that, because we have an into that group. But other counties might have similar, things going on related to substance abuse. And related to that, she feels that there's really a lack of data statewide as to how extensive this problem is. And she recommends that there be an overdose of a fatality review board at the state level. This is something that apparently some people have proposed to the state, but they have not followed up on it. And that might be something that if there are enough people involved in substance abuse, that we could look at and pursue. And personally, I'm still very much interested in Medicare and improving Medicare, even though we do not have Medicare. These DC, the direct contracting entities are very bad, particularly if we go to Medicare for all. It's not going to be any good to go to Medicare for all if it's all privatized. And that's what they're doing. They're moving into the regular Medicare programs.
Okay. All right. I've noted that. Kathy.
I think that for future discussion, it's really important that we talk about, instead of kicking the can down the road, what are we going to do until such time that we get the private universal health? I think that we have to, as a group, come up with other options of what to do for, number one, the fentanyl deaths, Number two, making sure the deaths are actually logged in as fentanyl death. If a patient stays in the hospital after a fentanyl overdose for a month and then dies of pneumonia, he will have logged in as a death of pneumonia. So I think that importantly that we start having our coroners and our assistant coroners log in the deaths correctly. And if fentanyl or drug overdose is part of it, it should be on the death record. The other thing is to come up for another discussion of what can the state do for the working poor? And I know I'm hammering that in tonight. It's only because we have Medicare, we have people who are employed, who have health care. What are we going to do for the people who are the most impacted by the healthcare system?
Okay, all right, excellent. Elaine.
Is I have agreed to be one of the people on the LAC for healthcare, and
Yes.
I would encourage other people to join in on that so we can share, the responsibility, and we could have a little committee because it sounds like it's a lot of work to do, and I have other work to do too. But anyway, so I just would encourage people to really look into it.
Thank you, Elaine. Can I hug you? Yes, as I said, and Lynn is right on. If we can get a team of members on the LAC who specialize in healthcare and can really understand it because of their background as well and their experience, that can go so far in helping all of us understand. So
will you just give us a contact so that we can contact whoever it is?
That's what Andrea and I do. We're both on the Legislative Action Committee. My specialty is education legislation, so that's what I follow very closely. I have a doctorate in education, so that's my claim to fame. And Andrea is the one who oversees all of us on the Legislative Action Committee.
Great.
Yes.
And I'm going to put my email in the chat right now. And please feel free to reach out to me if you need information or if you have any questions. We're always happy to chat.
Yes,
Great.
indeed. Now I have one last thing because we are at 6:30. Would any of you like to facilitate this task force? And what that would mean would be to create meeting agendas, to facilitate the meeting, to record it to the cloud, which is a push of a button, and to take meeting notes. So that's what a facilitator would be doing for this group. I would love to have you consider doing this and help that way. You can let me know. You have my email address in the chat. I see Elaine has put hers in there as well, and Andrea. So just let us know.
And I'll just add to that Kathy, Beth, and I will help support the facilitator in their role too. And we understand that conflicts come up, and we may have to kind of take team schedules. So if it's something that you'd like to do, but you're a little bit worried about the consistent commitment, don't feel like you can't ever have a life outside of the task force. We know that everybody is busy, and we'll find ways to support.
Right, exactly. I'm planning on being to as many of these meetings as possible as the liaison to the board. So you'll see my happy face, and you'll be teaching me so much. I appreciate it a lot. Any final thoughts?
I just have a question. This is Cheryl. Is this a monthly meeting?
Yes. we-
Okay,
We would like to get this to be a monthly meeting, hopefully on the first Tuesday of the month. So you can put it on your calendar.
okay, thank you.
Yeah, yes. Anybody else? All right,
Okay, that's
Approved.
5:30 on January 3rd.
yes. I believe unless, because we were, hold on one second, let me look at the calendar. Because yesterday we were looking at the calendar, because the education committee is on the first, or the task force is on the first Monday of the month. And if
Moved
we
it to
go
the
to
9th.
January, yeah, that we moved that one to the 9th. We can move this to the 10th just for January, if you're interested in doing that, if that would be better. So what
Makes
would
no
you,
difference to me. 3rd is fine.
okay. Anybody else?
It would help me if we can move it the week after. But
Okay.
if the rest of the group is gonna be okay with the 3rd, I can do that, but.
What would you like to do? I'll go by majority rule here.
The
Yes.
9th or 10th is fine with me.
Doesn't
The
matter to me.
All right. And what are you saying, Elaine? No for the 10th?
Yeah, the second Tuesday, I always have something.
Okay. Okay. All right.
Although that does begin at 7. So I
Oh.
guess I could,
Okay, it's
now
just,
that I think about it.
it'll just be for next month. That's it. You know, after that, we'll go back to the first Tuesday of the month. So if that's fine with everybody, I will let Beth know and she can change that on the calendar. Okay. That work? All right. Well, happy holidays. All right.
Happy holidays, everybody. Thank you
Happy
so much.
holidays to you.
Thank you for a
all.
rich conversation here. Have a good evening.
Bye-bye.
Thank
Thank
you all. Bye-bye.
Thank you.
Bye-bye.